One of the questions that always come up when dealing with schizophrenia is inpatient care really necessary? If so, when should we consider it? And honestly, it's a tough call, especially for families. You might be thinking, I want them at home, but I'm not able to manage them. Second thing is you will want to get help, but you'll worry if it will make things worse. These worries and fears are natural. In this video, I'll tell you 6 most commonly occurring scenarios that you should be careful about. There are certain situations when keeping them at home is not safe, both for them and those around them. Number 1, danger to themselves. One clear sign is when they pose a danger to themselves. For example, in situations like these, they haven't eaten in 2 days because they believe their food is poisoned. Or they keep saying, the voice told me to jump from the window. Basically, more than just a hallucination, this is a serious risk. And at this point, you need to ask yourself, can I manage this situation safely at home? If you feel unsure or overwhelmed, it's better to take them to a professional intervention. In some cases, inpatient care is the only way to protect them from harming themselves. Number 2, strong hallucinations and lack of communication. When their hallucinations are severe and you can't hold a meaningful conversation with them, it's another warning sign. They may say things like, there is a person in the room telling me to leave, and at this point, regular conversations actually stop. They may not be able to express what they feel, or even worse, they won't listen to you at all. Even something as basic as reminding them to take medications might not work. If you feel your communication attempt is not working, take them to professionals for one-on-one intervention. The professionals are trained to take care of them and communicate effectively with schizophrenia patients in ways family members can't. If they think inpatient care is required, then it is best to consider it. Number 3, no medications or having no routine. If your loved one stops taking medications altogether, either because they don't believe they need them or they simply refuse, this is a major problem. Without medications, symptoms spiral out of control quickly. In this case, you can take them to one-on-one intervention with your doctor, and if it's not working, inpatient care might be the only option to bring them back to a stable state. Number 4, isolation and erratic behavior. Sometimes their behavior becomes unpredictable. That is, they might lock themselves in a room for hours, avoiding everyone, or act out in public. They might do things that don't make sense, like climbing walls or walking into traffic. At this point, it is very important to keep them in a really safe environment. We have to make sure they don't hurt themselves or others with this erratic behavior, and it's important they live in a stable environment. Number 5, paranoia and violent episodes. Schizophrenia can sometimes lead to extreme episodes of paranoia. They will believe that everyone around them is trying to harm them. They might become physically aggressive because of these thoughts. If their paranoia increases and they become violent or aggressive, we need to act quickly. You must get them into an environment where professionals can handle the situation and ensures everyone's safety. Number 6, avoiding acute triggers at home. Apart from all of that, this is very important. There are certain situations that are too triggering for someone with schizophrenia, like a death of a loved one, family conflicts, or substance abuse at home. It's not advisable to keep them around these acute tragic situations. Even if you think you can manage, emotional stress can escalate their symptoms. This could further increase their paranoia or isolation. In these moments, it's important to ask yourself, am I really equipped to handle them at home? If not, inpatient care might be really necessary. See, I'm not saying send them to an inpatient care right away. When you find things getting out of hand, try to work with a professional one-on-one. They might respond better to someone outside of the family. But if that doesn't work, or if things continue to get worse, inpatient care is the next step. I understand. Making this decision isn't easy, and it's normal to feel conflicted about it. But remember, it's not a punishment. Inpatient care is about stabilizing them, giving them the care they need, and making sure they are safe in a professional setting. It's okay to take professional help when things become too overwhelming. It doesn't mean you are giving up on them. At the end of the day, your goal is to help them recover and create a safe space for healing. Remember, there is always hope for a better tomorrow. Thank you and take care.